Dr. Wilkins, I know that you've been studying nitric oxide since 2005. What practitioner has made the most impact on you?
Well, there's been many, and I looked at several books that were out there. One was by Dr. John Cook, and that was revolutionary. I was hearing from many practitioners because I was so blown away by the research, started to use it with my patient base, saw phenomenal results. And so one of the individuals that I got to hear speak, and then eventually we're on the same medical advisory board, was Dr. Joe Prendergast. And so I really call him my nitric oxide superhero because you have the Nobel Prize winners as well. In 1998, three doctors that were given the Nobel Prize, and that's profound. But from there, what do these practitioners do with that information? And Dr. Prendergast had more experience using nitric oxide based nutrition in his practice more than any other doctor that I ever knew. And so Dr. Prendergast was an endocrinologist, a diabetic specialist. He developed atherosclerosis in his abdominal aorta that was seen in a CAT scan back when he was, I think it was 36. So he knew he was in trouble. His dad got a stroke in when he was 42 years old, and then he died in his mid 50s. So that obviously had a profound impact on Dr. Prendergast. So he knew that he needed to find something in nature that was going to help him. And he knew that there was a possibility with that. So he used to lecture with a doctor named Dr. Victor Zhao, who was the head of cardiovascular research at Stanford at that time. He went on to Harvard and then Duke, and this guy was a real genius. But Dr. Prendergast and Dr. Zhao used to lecture together regarding statin drugs. And Dr. Zhao would talk about statin drugs and how they benefited cardiovascular patients. Dr. Joe would talk about how they would benefit diabetic patients. Well, Dr. Zhao leans over to him after one of their presentations and he says, I got some research that you're going to really love, because he knew that Dr. Prendergast was having his own issue. And Dr. Prendergast was like, well, tell me, what is it? And he says, well, I can't tell you. It's my research. So, doctors are famous for stealing each other's research. So he didn't tell him. But this is the early days of the internet. And Dr. Prendergast went to the internet and he found out it was about arginine and what it can do for the cardiovascular system. So Dr. Joe started taking arginine himself, and he used it for a period of over 10 years. And now you fast forward about 30 years from when his colleague took his CAT scan and showed his abdominal aorta being blocked up. And now he's in his 60s, and his colleague does the scan again. And this time he says, what are you doing? And I want to do it because he had completely reversed his own atherosclerosis. And he even had a calcium score test done after that. It showed zero. And so he was like, wow, this is profound. And then he took that knowledge and started to implement it with his diabetic patients, because 75% of diabetics die of complications of cardiovascular disease because of what it does to the endothelium, shreds it up, and they virtually make no nitric oxide or very little. So he was sending 250 patients a year to cardiologists after arginine therapy, about one per year. And so the cardiologist that he used to refer to, they took him to lunch. There's three of them. They went together and said, hey, we need to see what's going on, why we're not getting patients anymore from Dr. Joe. And Dr. Joe started to explain the miraculous benefits of nitric oxide and arginine and all these things, and they could care less. Two of them ended up closing their practices. One of them moved to Atlanta to reestablish himself to do surgeries and things that they're trained to do, and what really that doctors make a lot of money doing. So time went on, and he had those same results, to the point where his track record with his diabetic patients for 25 plus years, they did not have a heart attack or stroke, not one of his patients. So just a dramatic results using arginine. And so I was blown away by his story. He is just a profound doctor in his own right, and the things that he was able to share and do for those 25 years. Very much respected and do respect the legacy that he's left with regards to arginine. And so to this day, based on the things that I've seen already in my own practice and his practice and other doctors' practices, you just couldn't tell me that arginine and these precursors, these amino acids, are not the most therapeutic way to really make a dramatic impact on people's endothelial health, which in return is going to cause dramatic results for their cardiovascular health, in turn, their whole health in general. So just a wonderful practitioner. So glad that I got a chance to know him personally, speak with him on the same stage, and learn from him.
Fantastic. Thank you.